So the title is Harnessing Professional Practice, as you've seen, and I and Pamela will be able to have this conversation, and I'll be able to really quickly run through regulation education so that we have more time for us to be able to interact in regards of the conversations we have. So the perspective of regulations is basically the regulated professional we are able to govern and we are able to regulate. At the same time, as a government, it is a law, and we are required that all our activities in our jurisdiction is under observation for purposes of public interest. Our nurses and midwives, we provide a significant proportion of the care to the patients which receives in health care. They handle a lot of complex issues as they deliver the health care. At the same time, regulations become very important to the public and provide safety in regards of basically service delivery. Moving next is that then, what are the core issues that basically governs regulations? And I've highlighted three broad areas: issues of education and training, and I cannot overemphasize issues of training, effective recruitment and management, and I'm very happy to see most of our colleagues present here are those that they are actually within our training institutions. And issues of training really mirrors also the clinical practice. When we were reviewing the laws and acts which actually govern enactment of most of the institutions, when they talk about training and education, they are able to offer training either in the clinical placement, on the on-job training, and also having institutions as learning institution. Again, we are talking about issues of training methodology. Is it effective? Education standards and accreditation, clinical instruction, issues of faculty, and also competency assessment. When we come to the second phase of registration and licensure is how are nurses and midwives able to maintain integrity of our licenses to ensure that registration and licensure is provided and the standards are met, so that we don't find other people who have no training in nursing appearing in our registers. And I want also to thank so much, because we get a lot of feedback, especially even our colleagues who have trained outside Kenya in our other jurisdictions. And of course we get the feedback that could you basically check on their competencies before you register them. So most of us in the service delivery, you are the one who consume these services, and you are able to just tell us the nurses or midwives who have trained in these facilities are really not very competent and they need a bit of support in regards of the mentorship. Recognition of professionals from other jurisdictions. Nursing is a journey, and I know my predecessor Elizabeth is here. We started a long time ago, and of course, most of our colleagues who are even there, we started from certificates, diploma, degree, masters, and even some of us in this platform, we are enjoying the efforts of other people being ensure that there's PhD programs and we are able to basically advance. Certification and accreditation is also what we are also ensuring we do that. And finally, professional conduct and practice, issues of regulatory tools and guidelines. And as you may be aware, we already even have advanced nurse practice where we have been, where we are developing the APN scopes of practice, and majority of you have also participated in the scopes of practice development. Monitoring and evaluation is continuous. And finally, enforcement and discipline. And I know once I finish this presentation, we'll have a lot of conversations in how do we ensure that we enforcement, how we do ensure disciplines is actually conducted. Okay, so the perspective of regulations, as I had mentioned, I think this was the first slide, so we go to the issues of regulation role. So regulation roles ensures there's consistency and there's control, and we maintain that as a profession. And by just a way of telling you that within the health sector, I think Nursing Council of Kenya has done a lot of work if you compare to the others in regards of regulating the professions. We are mostly a benchmark. And even beyond health sector, we are having Engineering Board of Kenya coming to us and telling us how we do things, even Legal Council of Education. We are even having a Board of Engineers and architects and always, having that conversations. Even as we even talk about issues of indexing, online exam, issues of CPD and all that thing, we are, because our profession is supported by the international standards. It is easy for us to benchmark as opposed to the other professions where most of the time the nursing is not standardized. So I think we have a niche as nurses and midwives profession because we are able to leverage within the international and accredited standards and also the opportunities that we have on day to day. Okay, so quickly to highlight, we all know this, that The issues of regulating nursing is to protect the public, so that when our mothers, when our children, and other people, they go and get the nursing services, is what it is. And I didn't realize that 7 minutes is that, and time is up, so I'll quickly rush 3 minutes. So we set and enforce standards of nursing, and please, when the regulator talks, just give at least 10 minutes. So we monitor. I haven't even finished. We monitor and enforce standards of nursing. We set the guidelines and that. Again, to touch base on the other slides on digital health, is use of the digital tools. Pam will talk about research and talk about the innovation, but when we want to basically think of advancing our career, our profession, we also need to think issues of nursing shortages. How do we balance the standards, issues of work environment? How do we ensure our environment is really workable and it is conducive for nurses and midwives? The issues of burnout, the scope of practice limitations, and inadequate education and training, diversity and inclusivity within our workplaces, within our curriculum, understanding cultural competences, and finally, issues of staff welfare and mental health. Of course, the issues of mental health I've seen in the program will also be addressed. The three issues that we want to discuss as we move on: educations, we've discussed about issues of education and competency standards, regulations of the nursing program. The practice, I already highlighted that, but again, there's also what we call licensure and mobility, and modernization of the scope of practice, ensuring we enforce the code, and again, interprofessional collaboration. We don't work in a vacuum. We need to be able to ensure that we work with our other colleagues. And finally, leadership and governance, which I can't underestimate. Importance of board governance, importance of legislation, collaboration, and also resource mobilization. Again, let us also think of our next generation of nursing workforce in regards of technological competence, flexibility, and work-life balance, collaborative practice, diversity, social advocacy, lifelong learning, and of course, mentorship and support. Our next generation really need this. We need this so that everything we do, we know this generation Z, so we really need to figure out how does regulation support this. And even before I sit down, I just want to know by show of hands, how many of us are below 30 years? Thank you so much. So it means that we are talking to ourselves. We don't have the next generations in this conversation. And so much, thank you so much. The next one, let us recruit the generation. Yes, asante sana. Thank you.